The stroke pathway. Welcome to the stroke pathway. You are currently at Queen's Medical Centre and you have had a stroke. This may have been a clot or a bleed on the brain, and this can cause a variety of symptoms such as speaking, swallowing or chewing problems, weakness or numbness on one or both sides of the body, making it difficult to mobilise, difficulty doing your usual activities of daily living such as washing and dressing yourself or walking. Your thinking skills may have also been impacted. If you have any medical questions, please ask one of the doctors on your ward. Here on the stroke pathway, we have a specialised therapy team that are here to help once the doctors are happy with your medical status. The therapy team are made up of physiotherapists, who are here to maximise your movement and increase your strength. They also aid with safely discharging you when you are ready. Occupational therapists, who help with your activities of daily living, thinking skills, planning and coping at home after a stroke. Speech and language therapists, who are here to help you with your swallow, speech and eating after a stroke. You are usually admitted onto our hyperacute stroke unit, which is C4, where you will have a confirmed diagnosis. You will then be seen by a therapist and they will guide your journey to recovery. Your journey will vary depending on the severity of your stroke. Options include home, with or without community therapy, home with a package of care, with or without community therapy. You may need to move to Ward C5, which is our acute rehabilitation ward. You may go here if you have ongoing medical needs as well as rehabilitation needs. If you require a feeding tube, you will continue your rehabilitation on C5. You could move to Daybrook Ward at City Hospital. This is if you are medically well and do not require a feeding tube. This is to continue your rehabilitation. Connect House. This is a temporary care home based near City Hospital where you have therapists come in and see you regularly. You have to be in a side room here and safe on your own at night time, as well as being medically well. Move to a care home or a residential home permanently. This is usually social services that determine this pathway and is the least common. This is for people that have usually had a period of rehabilitation but unfortunately do not improve enough and would not cope at home with carers. All pathways will be determined depending on your needs and your goals. The therapists on your ward will determine your pathway and discuss this with you and your family. If you have any questions about your rehabilitation journey, please do not hesitate to ask your therapist. On each ward, you can also ask your discharge coordinator, who is usually wearing a red uniform, when you are being discharged from hospital and what the plan is.